experienced is the surgeon in performing the ETS? In other words, does a surgeon do 1 or 2 every month or so, or is it several per month, or how frequently, how often have they, say, kept their hands in doing that particular precise procedure? How many incisions are made? Is it 1, is it 2, is it 3? And how large are the incisions? Because the larger each incision is, the more pain the patient is going to experience, especially if the incisions are made in the chest wall, because there's nerves. Say these are your ribs, and there's a nerve, intercostal nerve, that runs underneath each rib. And for every incision or instrument that's placed inside the chest wall, another point along the nerve or along the intercostal nerve is disturbed, which causes much more pain. Another question to ask is the surgeon experienced with doing the ETS or the sympathectomy for the symptoms that you suffer from? In other words, if you're suffering from, let's say, severe palmar, some surgeons will do a T4, T3, some will do a T2, some will do a T2, 3, and 4. Or if you suffer from, say, severe facial sweating, where it just drips and pours down, or scalp, or both, where it just drips down, going to a surgeon and asking, well, has that surgeon actually performed their technique on a patient that suffers from these symptoms that you suffer from, and what type of results have they experienced without, say, a Horner's or drooping of the upper eyelid? For instance, the ETS procedure, the micro ETS procedure I do, which I don't disturb the surrounding tissues by digging out the nerve, so to speak, to find it. But the precise division of the nerve right where it crosses the second rib head without pulling on the nerve or digging it out really reduces or drops the risk of Horner syndrome or the drooping of the upper eyelid significantly. And that's another question to ask, is what's their incidence of, say, a Horner syndrome? Although Horner syndrome is very rare in most surgeons' hands.